Hello, it's Sunday, 1st of June 2025, and I'm just doing a very quick update. Things are very, very tough at the moment. Struggling with liver failure is one thing. That's probably a result of the treatment I did in Osaka, just putting chemotherapy directly into the liver tumours through a catheter in my leg. It looks like some kind of abscess has formed in one of the areas that were treated, so that may be causing some of the trouble. And also, just the tumours are now growing into and around the big blood vessels in the liver. But it looked like my bile duct could be blocked, in which case I'd need the surgery to replace the stents or put in more stents. But I did a scan and that looks okay at the moment, so I don't need the surgery for the moment. But that area is being attacked by the cancer. So the cancer is like attacking above the plastic stent, attacking the bile duct and narrowing it a little bit there. I'm now getting circulation trouble because of the cancer growing into and around the big blood vessels in the liver, especially the portal vein and the vena cava. So all of this makes me very, very weak all the time, and I'm on opioids for the pain, so I'm hallucinating a lot throughout the day as well, which is tough to deal with, and I can't sleep at night. I'm very drowsy and fatigued in the daytime. Another big problem is swelling of the intestines. Seems like I've got about 2 litres of fluid around there. And the fluid can't be drained. It's not between layers of tissue, it's between the cells. So it's called edema or edema, some people pronounce it. It can't be drained. There's no real way to get rid of it except to deal with the root cause. The root cause is the decreased blood flow from my intestines to my heart. It means that fluid's not getting removed, so it's building up around the cells. If you're kind of around and being quite kind of skinny, and then having this bulging lower abdomen like you're in a famine or something, and any pressure on the abdomen is very painful, and it causes GI issues as well, diarrhea, whatever. I'm taking steroids for that. I think maybe helping slightly, but again, the steroids have side effects, and if I keep taking them, they're going to do damage, because that's what steroids do, oral steroids. So that's becoming a problem. I'm afraid because of that, or partly because of that, I can't have visitors. I get messages sometimes, people saying like, can they drop by at the weekend? I'm sorry, the answer is always no. I mean, in any case, I can't have visitors at the house. Things not set up for that. I mean, I'm in a serious medical situation, so I'm afraid I can't have you coming over for a chat. I think people have an image that I'm kind of, lying in bed, convalescing. It's not that at all. So again, very well-meaning people are kind of saying things I should be watching on Netflix or whatever, entertaining stuff. Can't deal with anything like that. There's no time. I mean, at the moment, it's about keeping going. It's about eating. My oncologist, that's like my main doctor, he sort of wants me to stop all the treatment now. He thinks I've got to the end. Maybe it's time for hospice care. I want to fight a bit longer. I'm starting radiotherapy next week. It'll be 13 days of radiotherapy. The radiotherapy itself probably won't have any major side effects. I've had radiotherapy before and it's been fine. But for me, this is going to be incredibly difficult because it's like a 2-hour journey to the hospital. The place I did it before was only an hour away. And that was a few years ago when I was fit and healthy. I'm not fit and healthy now. I'm just getting like hiccups of a painful side effect of the steroids and also of the opioid painkillers. Also maybe both the steroids and opioids are causing my diaphragm to go into spasms sometimes a couple of times a day. It's absolutely terrifying because it can last up to almost 10 seconds, and at that time I can't breathe. That's really scary. So, trying the radiotherapy, hopefully. It's going to be tough, 2 hours travel each way, and it's an hour and a half, and then a bus on train and a bus journey. Transport in Tokyo is fantastic when you're sort of healthy and stuff, but it's difficult for me. I'm also starting hydrogen therapy at home. So this is breathing air from a machine where the hydrogen content is a bit higher than the normal air we breathe, or considerably higher than the normal air we breathe. So I don't really know how the machine works, but it has a source of, you sort of fill up the tank with deionized water, and it does electrolysis or whatever, gets the hydrogen from there, puts it out through an airway, and it sort of clips on under your nose, and you breathe that way, just like you'd have oxygen in a hospital. And the idea for that is possibly it helps with the liver a bit, with the repairing of the liver, but also it seems to help the T cells, which are kind of white blood cell, and a very small percentage of T cells can attack cancer cells. So maybe some kind of benefit there. Unfortunately, that's not covered by insurance. Got to rent the machine. I haven't had enough donations recently, so now at the point where certain treatments are not available for me. Fortunately, a very dear friend is covering the cost of the hydrogen machine, the rental, the 3 months rental. It's incredibly generous of her. To go along with the radiotherapy, because the type of cancer I have, colon cancer, is very resistant to radiotherapy. But one of the ways you can sensitize the colon cancer cells is by heating the tumour, so hypothermia therapy. I'm hoping to do that twice a week, and 1 time a week is covered by the insurance, 1 time isn't, so I've got that expense as well. Of course, all the transport expenses. So if you can donate, that helps me out greatly. So from now on I'm going to be even more busy than I usually am. I'm usually very busy, but from next week I'm looking at 7 to 9 medical appointments a week with the daily radiotherapy and the hypothermia a couple of times a week, and appointments with the oncologist and the testing, whatever. So it's a lot of work. But yeah, thank you so much for the support. I have to be a bit careful posting on Facebook now, because I've noticed when I I'm trying to be neutral when I post, but sometimes, there's this whole stream of comments about it's great news or whatever that I've been accepted for treatment, but I'm sorry, it's not. It's being accepted for treatment doesn't mean I can necessarily have it, because of just the situation of the liver, kidneys, heart. I might be accepted for treatment starting a week later, whatever, and just get rejected. I mean, this radiotherapy had to delay for a bit, and it looked like I wouldn't be able to have it, and I still don't know what's going to happen when I turn up at the hospital. So I really appreciate the comments, but please understand I'm not being rude when I try and reply and say, well, it's not what it seems. And if I do get accepted for a treatment and I can do it, realistically I'm very, very late stage, so the chance of actually having an effect is small. I'm at that kind of point where it's I'm still fighting. I want to still keep on fighting. I'm having a kind of a consultation next week at the hospital about hospice care, end of life care, moving into the hospital, and looking at some other hospitals as well that have a palliative care unit. I'm still doing my best. I'm still fighting. I'm still trying to do the non-profit stuff as much as I can. Still trying to help patients who contact me who would like to do treatment in Japan. So kind of a short update there, but I just wanted to show I'm still here. If you can donate, it makes an absolute world of difference. If you can share my videos, if you can hit like, if you can hit subscribe, if you can comment on the videos, all of that helps. Like, people keep saying they want to help. Please do those things. Please write a comment, because then YouTube shows the video to more people. Please donate if you can, because I've got expenses piling up. I'm going to have to pay for the treatment you pay for first. So all that's happening. But yeah, thank you so much. I do appreciate it. If you are in Tokyo, I do want to see you, but it's not a case of dropping around. It's more like if you can get in touch and we can try and get a few people together, we can kind of meet in a cafe or something. It's much more manageable for me. As I said, I've got medical stuff going on at home, machinery, family. So it's much more appropriate to, let's get together for a cup of tea and a nice chat in a cafe with a couple of people. Like, I can't have someone come over and hang out at the house. I'm so sorry. And that sounds really horrible, but yeah, it's just not practical. Yeah, thank you so much, and please share the donation link if you can, and please donate if you can. And another couple of videos soon will be answering your questions that you post on Facebook. Thank you so much for the questions. There's great questions there. Really excited about answering them. So I'll get those couple of videos done for you next week. Thanks a lot. Goodbye.